Flexor retinaculum. So let's discuss the topic of flexor retinaculum. So the other name of flexor retinaculum is, it's also called as transverse carpal ligament. So it is also called as transverse carpal ligament. So flexor retinaculum, which is also called as transverse carpal ligament, is medially attached to. So actually it's a modification of deep fascia, and on the anterior aspect, so on the anterior aspect of the wrist level where there is continuity between forearm and the palm, at the level of the carpal bone, medially and laterally, we have got a modification of deep fascia which is called as flexor retinaculum. Beneath this, we have got osteofibrous tunnel, and in that tunnel, we have got the passage of flexor tendons and median nerve. So actually, it is keeping all the tendons together, and they are not separated when they are passing from the forearm and reaching the hand with the respective tendons for the respective fingers. Okay. So this is a modification of deep fascia, also called as transverse carpal ligament, and it is important for us to know the attachment of flexor retinaculum medially and laterally. So medially, flexor retinaculum is attached to medial carpal bone, that is pisiform bone of the pisiform bone of the proximal row, and hamate bone, hook of hamate bone on the distal row. Laterally, it is attached to two other carpal bone, that is tubercle of scaphoid. It is attached to tubercle of scaphoid and crest of trapezium carpal bone. Now, I would like to show you this diagram. So, see here, this is the diagram which is showing you the flexor retinaculum. So, this green color structure which you are seeing is the flexor retinaculum. And below the flexor retinaculum, there is a space, that space is called as carpal tunnel. So, you can clearly visualize that scaphoid bone and trapezium, these are the two carpal bones which is giving its lateral attachment. Hamate and pisiform is forming its medial attachment, and this green color structure is called as flexor retinaculum or transverse carpal ligament. The space which is lying below, this space is called as carpal tunnel. This space is called as carpal tunnel, and we have to know the structures passing in the carpal tunnel. Before that, I would like to explain few important points by the means of this diagram, and I will also write it for you. So what you can see, the exact shape of the fibrous retinaculum. So you can see here with green color the fibrous retinaculum has been shown, and you can clearly see, if I enlarge this, you can clearly visualize it's Y shaped, and in between the two slips of flexor retinaculum, the tendon which is passing is flexor carpi radialis. The tendon which is passing is flexor carpi radialis. That means flexor carpi radialis is neither passing superficial nor passing deep to flexor retinaculum. Now, deep to the flexor retinaculum, the space which is lying there is called as carpal tunnel. Let's see the structures passing in the carpal tunnel. The most important nerve which is passing through carpal tunnel is median nerve. Other than that, we have got flexor pollicis longus, which is covered with radial bursa. The tendons of FDS and FDP is covered by ulnar bursa. So this tendons of flexor carpi, the tendon of flexor digitorum superficialis and tendon of flexor digitorum profundus, okay, having a common sheath surrounding it, that is the ulnar bursa, and flexor pollicis longus, which is passing through radial bursa. Now, superficial to it, we have got the ulnar nerve and ulnar artery traversing, and also so from medial to lateral, we have got ulnar nerve, we have got ulnar artery, we have got palmar cutaneous branch of ulnar nerve. In between the palmar cutaneous branch of ulnar nerve and median nerve, we have got palmaris longus tendon. So these five structures are passing superficial to the flexor retinaculum. Here I just want to tell that there is a superficial slip from the flexor retinaculum which is passing over that ulnar nerve and ulnar artery. That is superficial slip of flexor retinaculum is called as volar carpal ligament. So that means ulnar nerve and ulnar artery is traversing above the flexor retinaculum and below the volar carpal ligament. This and they reaches in the hand region, and this space is called as Guyon's canal. So let us write that. So please write down structures passing superficial to flexor retinaculum. The structures passing superficial to flexor retinaculum are following: ulnar nerve, ulnar artery, palmar cutaneous branch of ulnar nerve, palmaris longus muscle tendon, and palmar cutaneous branch of median nerve. Palmar cutaneous branch of median nerve. Now, here I just want to write one important point, that ulnar nerve and ulnar artery is traversing deep to superficial slip of flexor retinaculum. What is the name of the superficial slip of flexor retinaculum? That is called as volar carpal ligament. Okay. Now, it is also important for us to know the structures passing deep to flexor retinaculum. The space lying below flexor retinaculum, that space is called as, so I would like to write here one more point, that the space below flexor retinaculum, is called as carpal tunnel. And the compression of median nerve in the carpal tunnel is called as carpal tunnel syndrome. The structures traversing are tendons of, 4 tendons of FDS. So, tendons of, that means 4 tendons of FDP. These are 4 tendons of FDS and FDP. Also the tendon of flexor pollicis longus. So, here tendon of flexor pollicis longus is passing through the radial bursa, and common sheath of ulnar bursa is covering the tendons of FDS and FDP. Also, we have got the median nerve traversing below carpal tunnel in the osteofibrous tunnel. So, only there is chance of compression of median nerve in this space, and that condition is called as carpal tunnel syndrome. I would also like to write one important point here. Please note down. Tendon of flexor carpi radialis neither passes above nor passes below flexor retinaculum. So, tendon of FCR, flexor carpi radialis tendon, is neither passing below nor passing above the flexor retinaculum. This is very important. So, yes, in short, we have seen the attachment of flexor retinaculum by this diagram. We have also seen the contents passing superficial to flexor retinaculum. The contents are written from medial to lateral. These structures which is passing above the flexor retinaculum is written from medial to lateral. Then we have seen the structures passing below. This is a diagram which is showing you the structures passing superficial and deep to flexor retinaculum. Thank you.